Okay, today we're going to be doing a subcutaneous heparin injection. So the first thing I'm going to do is I'm going to administer the medication with the 6 rights. The 6 rights are the right dose, the right time, the right person, the right route, right medication, and right documentation. The first thing I'm going to do is I'm going to remove any trapped medication from the top of the ampule by flicking it. I'm going to take a alcohol gauze, and I would wash my hands before this. And I'm going to break the ampule away from me. Put that in the Sharps container. I am going to attach a filter needle to my syringe here. And without touching the neck of the ampule, I'm going to invert the ampule and insert the filter straw. And I'm going to withdraw medication. Holding the syringe inverted, I'm going to draw up 0.2 ml of air. And then I'm going to take the filter needle off. I'm going to check the dose, make sure I've got my dosage right. And I'm going to reattach the needle. So I'm going to dispose of my filter straw and my ampule into the Sharps container. And I am going to go to the patient's room. I'm going to identify the patient with 2 identifiers, usually the name and the birthday, and I'm going to explain the procedure and the medication. I'm also going to do my 3rd medication check at the patient's bedside, double checking dose, person, and any allergies. I'm going to wash my hands and put on gloves. First, I would position the patient into a supine position so that the abdomen is accessible and relaxed. And making sure to choose the abdomen site at least 2 inches away from the umbilicus. And then I'm going to clean the site with an alcohol pad from the center going outwards. And I'm going to let that dry. I'm going to hold the needle with my dominant hand, and with my non-dominant hand I will pinch the skin up, and I'm going to insert at a 90-degree angle. And I'm going to slowly inject the medication. And the 0.2 milliliters of air. And then I'm going to dispose of the uncapped needle into the Sharps container. And if needed, I'm going to gently blot the site with a gauze pad, making sure not to rub or massage the site. Okay, I would then document the medication, the dose and the time into the MAR and the nurse's notes.